About 3 months ago, the world recorded the first case of coronavirus in Wuhan, China. Presently, we have more than 600,000 cases and a rising death count worldwide. Today on Sound Health, we are looking at how to contain further spread of coronavirus. I'm Olasumbo Modupe. Welcome to the show.
5 COVID-19 patients have been discharged. The Chief Incident Commander and Governor of Lagos State, Mr. Babajide Sanwo-Olu, disclosed their discharge from the Infectious Disease Hospital after treatment and multiple testing by specialists. 2 deaths and over 100 cases of COVID-19 have been confirmed in Nigeria. According to the Nigerian Center for Disease Control, additional cases have been reported in Lagos, FCT, Ogun, Enugu, Ekiti, Oyo, Edo, Bauchi, Osun, Rivers, Benue, and Kaduna states. To immediately stop the further spread of COVID-19, President Muhammadu Buhari has ordered restriction of movement in Lagos, Ogun, and the FCT. Acknowledging that the measures will cause much hardship and inconvenience to many citizens, he directed that a 3-month repayment moratorium for all trader money, market money, and farmer money loans be implemented with immediate effect. Without compromising the social distancing policies, President Buhari also directed that a designated minister will be contacting the affected states and agree on detailed next steps with a 2-step approach to save lives. President Buhari appealed for contributions and donations coordinated and centralized to ensure efficient and impactful spending by the Presidential Task Force. The Lagos State Government, through the Office of Sustainable Development Goals and Investment, Lagos Global, has concluded plans to launch the Lagos State Volunteer Corps towards the fight against COVID-19. Earlier, the Governor of Lagos State had approved the distribution of food through the food banks and emergency shift markets to address the problem associated with the restriction order and promote social distancing in the fight against the spread of COVID-19. Daily lesson program for primary and secondary school students has also kicked off via radio and TV stations in the state. The governor also took delivery of a 110-bed isolation center from a financial institution for the management and treatment of confirmed cases of COVID-19. NCDC created additional molecular laboratory centers for testing in the country. Meanwhile, the Director General of National Agency for Food and Drug Administration and Control, NAFDAC, has ordered manufacturing of chloroquine for emergency stock for possible clinical trial treatment for coronavirus 2019. NAFDAC advised the public to desist from its use without the guidance of a medical doctor or clinician for cases of clinical trial treatment of COVID-19, as prolonged use can also cause retinopathy or vision impairment. The agency added that through her regulatory activities, it will ensure that the clinical trial protocol guidelines are followed and wishes the clinical research teams get success in stopping the raging pandemic.
It's still Sound Health on Lagos Television. Today on the show, we are looking at the rising cases of COVID-19 around the world as we also record more cases in Nigeria on a daily basis. I have with me Dr. Dave Oladele, a consultant public health physician and a research fellow at the Nigerian Institute of Medical Research. Welcome to the program, Doctor.
Thank you very much for having me. It's an honor being here today.
Okay, Doctor, it all started with a single digit. Sadly, we have COVID-19 across the world with rising death counts. How did we get here?
Well, it's a very long journey. Like rightly mentioned, it started early in the year, but 3 months ago. in China, and that little incident that happened in that town in China has become a global pandemic today. Actually looking at John Hopkins University Corona Watch database, today we have about 723,740 cases, 34,000 deaths, and some people have recovered. About 711 have recovered. It was initially limited to China. This one became a global public health emergency of national concern, and today is a pandemic. It just talks to the fact that the virus itself has a peculiar way of behavior, in a way in which that it spread very fast compared to other viruses that we've had. We know that coronavirus is self-zoonotic, meaning that it's a disease of an animal that got into the human population. And it's something that is new, that's why it's called the virus. So we don't know much about it, and that is one of the reasons why there's a challenge at taking care of the epidemic so far. But it has been learned in the last 3 months, and one can only hope that they get better. But most countries in the world have cases, and it is a global health emergency that affects global health security. And going forward, we just need to come together, to work together to see how we can nip this in the bud to prevent further spread.
Okay, unfortunately, Nigeria is not left out of this pandemic. Are we making headway in Nigeria? We have over 100 cases recorded recently.
Yes, Nigeria case a month now. We had the first in that case, the Italian that came into Nigeria, and within 48 hours, we were able to make that diagnosis, and all his contact was traced, and kudos to Lagos State Ministry of Health, they were able to take care of him. He got better, was discharged after the contact. But from then till now, because of international travel, we've had a lot of new cases coming into the country. As at this morning, we have 111 cases, and 3 have been discharged, and we have just 1 deaths, which is still a plus. But at this point, like I'm sure you've heard people talk about it, it's about that Nigeria begin to do the right thing. If we are going to control this epidemic, we need to take some steps right now to contain it, because it has potential to spread in a geometrical fashion, and it's time that we all come together as one and see what we can do to make this and to nip it in the bud.
Okay, some myths and misconceptions have been trending since the outbreak of COVID-19, ever since the outbreak. One of which is that it is a biological warfare. How true is this?
Well, if you ask me personally, I think at this point, the important thing is not the origin of COVID-19. What we know in the science world is that it's a zoonotic infection of animals that move to human population. So whether it is whether it is a mistake in the laboratory is not important. The important that it's killing people all over the world, and it's a major challenge. So what we should do at this point is to see how we can contain this epidemic, how we can protect the lives of people. When this is over, then we can now sit down and find out, okay, this, then what causes it? But for now, the important thing is not the cause. It is how do we go ahead to protect our human population, how do we prevent from spreading in our community, and how do we help those who are sick that need urgent medical attention. That is the important thing.
Okay, is it a flu or pneumonia? And is it also true that the virus cannot stand any hot climate region?
There's the truth about the fact that it cannot survive in a hot environment. Countries all over the world have cases. African countries that live in hot environment, we have cases. It's a good example. So it is not true that the black race or the people living in tropics cannot have cases. It is everywhere, all over the world. So that is not true. And it does have symptoms that look like common cold, but it's not common cold. It's not flu. It is a novel infection. It's an infection that people have not seen before, and its nature of spread is not what we have seen in about 100 years of human existence on the planet. So it's something that we need to take serious. We need to look for ways to mitigate the effect.
Okay, with dry gin, chili, garlic, and some herbal concoctions, one is safe. How true is this?
It is not true. There's no iota of truth in that. Herbal gin, dry gin, it's a viral infection. Okay, there's no amount of gin you drink that can cure it, and there's nothing like when you take herbal concoction. And I just want to say that we did not mention it yesterday. You have to be careful in particularly those people that say they are playing by this point. There's the normal way of critical scientific inquiry. If you have a claim, you must be subjected to clinical trial, clinical test to be sure it's true. And most people that say they have claim is not because they really have claim. They want to profit out of it. And some of these conclusions are not cheap. So if it is a truth or a claim that is true, give it out to people freely without taking money. So if they want money from you for what has not been proven, please be very careful. There's nobody who has not really approved any other compulsion as a cure for coronavirus. Thank you.
Okay, will use of masks and gloves protect you from the virus?
Yes, there's a lot of debate about wearing masks. But today, the WHO, that is World Health Organization guidelines for wearing masks, is that you need to wear masks if you are taking care of someone that has respiratory symptoms.
Okay.
Or you have respiratory symptoms. Or you are a healthcare worker who is taking care of patients in the hospital, but you want to do surgery. Those are the guidelines for wearing masks as of today. I am aware of different videos on social media that talk about the effect of wearing masks in preventing infection. And we know that this virus is a droplet infection. What does that mean? When someone speaks, cough, talk, sing, they produce some droplets from their mouth that's quite heavy. It travels far, just about a meter of thereabouts. So it will drop on the floor or any table. So if you are close to someone talking or coughing, you are likely to hear that droplet that is coming out of that person. So wearing a mask will actually prevent the droplet from going out. That is fine behind it. But as of today, both WHO or the Nigerian Center for Disease Control has not approved or have recommended that we should wear masks in the community. Things can change tomorrow, but as of today, the use of gloves. Wearing gloves is the important thing that we are talking about as of today. Good hand washing, not just putting soap and water in the hand. There's a particular way of washing hands. Wash for 2 seconds and clean every aspect step by step. And use hand sanitizer, that's alcohol-based hand sanitizer when you don't have access to running water. That is why I recommend not wearing gloves. Because if you wear gloves, the challenge is you don't know how to remove the glove. So imagine you wear gloves and you go out of your house, you get in contact with an infectious agent, and you bring it out in trying to remove the glove, you can actually spread infection on the skin. And if you don't wash that, eventually you're going to infect yourself. So the important thing is wash your hands regularly, avoid touching your nose, your eyes, and your mouth. That is your face. That is what we talk about, we preach, or we advise people to do in the community at this time.
Okay, medical experts have recommended social distancing. What is the universal rule for social distancing? Some will tell you have to stay away about 6 feet. Some also said 2 feet. What is the universal rule for social distancing?
The concept or the recommendation for social distancing stems from the fact that the coronavirus is or is spread by droplet infection, like I explained earlier, when somebody coughs, sneezes, it can travel from 1 meter. So that is why it's important that you maintain the distance about 8 meters. I'm aware the United Kingdom recommended 2 meters because they want to stay safe. So the social distancing is a different attempt at maintaining a certain distance for the person close because you don't know who has it. And it almost can be asymptomatic, not having symptoms as it transmitted. So it's better you maintain that distance. And that thing about social distance is working from home, avoiding gathering, because there are restrictions on the provision of gathering together of people. So if you reduce gathering together, you avoid conference, large gathering, you try to work from home, and you only go out when it's essential, maybe to buy medicine or to buy food. Then we're able to maintain social distancing, and that has shown that we have to contain the infection. like I mentioned earlier, the major thing about COVID-19 is the fact that it spread very fast. So the best thing to do is to maintain, to avoid crowded environments and to say that the droplets don't get into your hand, to your face, and you don't infect yourself. So this is what we know today about social distancing.
Okay, Dr. Oladele, is it true that those that recovered from COVID-19 suffer close to 50% of lungs damage permanently, which means they will be on medication forever or they may die from complications in few years later? How true is this?
There is no scientific sound evidence to support that claim. Like I told you, from John Hopkins website this morning, 146,711 people have recovered from this virus. And there's no documentation anywhere that shows that these people have the claim that them have lung damage. I also know that what I see some people that have this virus not having symptoms at all. It's mightiness, just come and go. And out of the remaining 20%, about 50% will have symptoms. Their case is about 5, and those severe cases occur in those with pre-existing medical illness, whether they have cardiac issue, some other binary respiratory like chronic obstructive pulmonary disease, and some other things and elderly. Now, what we are not clear about, as I said, is it not those people with their illness or anybody that recover from coronavirus? According to the WHO, as of today, there is no evidence to support that claim. And there are studies that look at 15 people that discharged from hospital. But there's a lot of statistics that evidence leaks of all of the things we can claim. Investigation, we cannot start that this is the cause of this. Because that it was a pre-existing medical condition that led to that. But it's not right to say that whoever COVID-19 will have residual long damage that will last for that time. It is not yet end proven. It is merely anecdotal. Just to put it clear.
Okay. President Muhammadu Buhari recently approved a lockdown in some parts of the country. What is the best way to prevent further spread? And do you think we need a total lockdown or a partial lockdown?
I've had this question many times but following best practices across the world, in China, in UK, in the US, we are lockdown in 30 minutes. And I wasn't so president to not lock down Lagos entirely. And the reason is just to work on the principle of social distance. It doesn't look like how it is and spread the community, because that is the best thing to care about. Community transmission that could be very devastating. Looking at that. So if we are going to contain it, we need to do some restriction movement. So that's why I believe the president was well advised by all the experts to say that is the next thing to be done. It might come with some challenges, some discomfort, but I believe at this time we have very few options. If we are going to control this pandemic, we need to take some drastic measures, and I think that is what the president has done.
Okay, according to the Director General of WHO, Dr. Tedros, asking people to stay at home and other physical distancing measures are an important way to slowing down the spread of the virus and buying time, but they are defensive measures. You can't win a football game only by defending. You have to attack as well. How do we achieve a successful attack?
Well, the basic thing we need to containment, okay? And the first thing there to protect the population, that is why we've talked about lockdown and also restriction of movement. The next thing we need to do now is that the public health agency now need to intensify case finding and contact tracing. That is what we can do as well. That all the cases we have now are contact. And according to the Minister of Health, we have about 5,000 contacts we are tracing. So we need to put a lot of effort to fight those who are positive, take them to get them treated, then we'll be able to go ahead and control the epidemic in our environment. So it is yes, we need people that are not yet affected, but those who are at risk and those who are potential people to spread the virus, we need to look out for. Get them tested, and also give them treatment. Because the earlier we start treatment, the better, and the better we are to control the epidemic in our environment.
Okay, will letting the public know the true state of statistics and information cause more harm like panic than brazen up?
Well, if you ask me sincerely, I think the Nigerian Center for Disease Control and the Ministry of Health led by the Honorable Minister of Health has done well in informing the public about the update of testing. I don't think that they've not had any info from the country. On a daily basis, you see update from NCDC. Even when the first case was diagnosed, still remember, some people now tell you that's not true. That to see the case, you want to know the name of the man. Before now, we have the 111 cases in our hands to handle. So I think the Nigerian Center for Disease Control and all the agencies on the partner levels, they've not been economical in talking about the current state. But we know that the public that what we see is usually the tip of the hat, meaning that we have more cases in the community that we don't, or we have not diagnosed yet. And that's why contact tracing is very important at this point. And to achieve that, we need to lock down, then be able to work and get this contact and see what we can do to get them tested, and if they are positive, get them treated. Then we are nearing control.
Okay, Dr. Oladele, that brings me to my next question. How long does it take to test for COVID-19? Do we have enough time on our hands?
Testing for COVID-19 globally has been major challenge. Like I mentioned at the beginning of this discourse, that is a novel virus. In other words, a new virus that does not have it's not we have new testing kits coming up. People watch foreign media, they talk about new testing kits in the US, and they are being talked about point of care tests in which you can just enter to a place, play a test within a short time, and have your results. But that has not been approved or validated by the country yet. Now, what we have in the country today is molecular biology technique, RT-PCR for testing. And what is done is to take natural true swab that we take to the laboratory and they run the test. And I'm informed that it takes about 24 hours to get the result back, from 24 hours to 24 hours at most to get the result back. So it's like that. We don't have any point of care test in the country as of today, and it's molecular and it's quite extensive. It takes time to get results. Even when you are tested, another lab still has to validate to be sure that the test is true, so that you don't label somebody having COVID-19 when they don't really have COVID-19. I don't say somebody does not have COVID-19 when they actually have. So there's need to make sure that both the sensitivity of the test is done and you do the control to be sure that you're doing the right thing.
Okay, I understand that the Nigerian Institute of Medical Research will begin testing free of charge. Is it open to the public? And what are the requirements?
Yes. Okay. I'm sure in the last 24 hours or 48 hours, you've seen the Honorable Minister of Health and also NCDC mentioned that they are scaling up laboratories to test for COVID-19 in the country. As of today, Lagos has 3, and the Nigerian Medical are one of those centers. And it is open to the public, but there are criteria to be tested. And the form online that people need to fill, and those who meet the criteria be called or invited for testing. It follows the NCDC guidelines for testing. Not anybody that can go. Some of those guidelines include who have history of travel in the last 40 days to areas that have complete transmission or high rate of COVID-19 disease, and those who are primary contact of these ones, they are supposed to be tested. So there's a guy that's a questionnaire that one would fill, and if you meet the criteria, be invited for the test. But it's part of the drive of federal government to make sure that we clean, and so that we can discover as many people who could be at risk who are exposed on time with a view to start treatment and also to
Okay, please share with viewers routine treatment for COVID-19.
Actually, the NCDC guideline is based on the symptoms, how severe the symptoms is that the patient are. For those with mild symptoms, what they need mostly is body treatment, monitoring and checking for the respiratory rate, checking for the temperature to be sure that it gets back, and to give them supportive treatment, treat symptoms as it was. For those with illness, they are admitted and they be monitored to check the temperature. I think if the more than 38 degrees Celsius, that's when the better admission. Respiratory more than 30. So this is, and also the SpO2 is checked regularly, and they are giving supportive treatment. And the guideline actually mentioned the use of some antiviral drug used for HIV. Though I don't know whether that's what they do at the side, but it's in the guideline. But it's mostly supportive treatment. As of today, there is no drug that we can say this is a drug for COVID-19.
This is where we say thank you on today's episode of Sound Health. Hope you've learned how to avoid contracting COVID-19. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.